You know, Bill, Carytown's a good example of some of the changes we've seen throughout the pandemic. Early in 2020, when it first started, this place was an absolute ghost town. Then, as things picked up last summer, we saw more people out here, but a lot of them wearing masks, a lot of signage on doors telling people about COVID precautions. Now, it's actually kind of difficult to walk down Carytown and find a sign that has anything to do with COVID-19. There are a few, though, and there's definitely still people wearing some masks, even though the CDC says that's not required at this point in the pandemic. We went searching for how people were feeling about that. The Sydnar's enjoying a nice spring day in Carytown. Walking around at this point in the pandemic, a blessing and a curse.
Since things have opened up, it's been somewhat of a blessing. The pollen has certainly affected my allergies.
Calvin and Joanna both work in healthcare and faith ministry.
We rejoiced in the fact that we're back in the community and worshiping in the building, but then we do it with caution.
Just trying to be safe, you know, and taking personal responsibility for our health, you know, as well as the health of others.
New subvariants of Omicron are helping drive up case numbers, and the percentage of positive tests in Virginia has jumped 10 percentage points in a month. Meanwhile, hospitalizations are growing but remain relatively low as health officials warn of another COVID wave this fall.
All researchers are trying to figure out, as this COVID virus begins to mutate and we get different variants, what are the consequences?
Dr. Richard Costanzo is studying just that at VCU Health. He's part of a research team that found instances of COVID patients losing their sense of smell or taste has dramatically dropped with Omicron compared to earlier variants.
The good news is with Omicron, we're seeing less cases of smell and taste loss. And so that means that less people in the United States will have this problem going forward. If you don't lose your sense of smell, it doesn't mean that you don't have COVID or should not worry about protecting yourself from getting COVID.
While Costanzo's team doesn't know why yet, the research is an example of scientists continuing to discover new information about COVID while daily life rolls on.
It's affected our lives considerably. I think we have to rethink how we behave and how we respond to health crises. We're concerned about the people that have the long COVID, the people that don't recover their smell and taste, and what can be done.
I think we have to have a sense of personal responsibility and equally compassion.
The Sydnors remain hopeful that at this point, Virginians will take precaution if a potential future COVID wave does hit.
The million-dollar question, you know, and I think that if the numbers creep up to where hospitalizations and death, I think we'll do what we have to do as a people in this nation. We continue to track the COVID data in specific localities throughout Central Virginia. You'll find that on WTVR.com.